Doctor, what has been your experience when it comes to the effectiveness of carbetocin versus oxytocin for the prevention of postpartum hemorrhage?
At the outset, one thing I would like to clear very too much for all my audience who would be listening and reading this, that carbetocin is only preventive. It is not to treat PPH. So the first point one has to remember that carbetocin can be only used to prevent PPH. But once PPH has happened, this drug has no meaning for use. Now, second thing is that we have been using oxytocin for a long time. The disadvantage that we were discussing was its maintenance of the room temperature and difficulties at the grassroots levels because electricity is not there to keep it into the required temperature was not possible. So effectiveness was not that much. But lately, since the carbetocin has come, I have both the drugs for my choice to use it. And we have found that so far I have used carbetocin in more than 8 to 900 cases already. I have used it, and almost I have replaced it with oxytocin as a preventive aspect for PPH, and we give it in all patients to prevent blood loss. And I think I found it very, very effective, and hardly we will enumerate about 3 to 4 cases where we had to use some extra uterotonics to prevent or to treat PPH in those cases.
And how has your experience been with the use of carbetocin in vaginal deliveries?
Same effect, because as I told you that I've used it in cesareans as well as in vaginal deliveries. Both places effect was same, and in vaginal delivery I think I did not have to use any uterotonics later on. There was no case of postpartum hemorrhage later on, so didn't use it. Twins were cesarean, so we had to use it. And that Akrita was also cesarean, so used it.
Doctor, would you recommend the use of carbetocin for the prevention of postpartum hemorrhage in every delivery?
Yes, I would recommend to each practicing gynecologist who's doing it, or maybe later on we may recommend it for the peripheral users also, because it's a safe drug given properly, very few contraindications. So I think it is something, a drug which is in our basket. We should be very, very happy with it, and I hope in years to come probably it may be an answer to reduce our postpartum death due to postpartum hemorrhage.
Doctor, any additional points of views that you would like to share regarding the use of carbetocin through your experience of so many years with using this drug?
One thing is that all the anesthetists should be well equipped with this knowledge about this carbetocin drug, because those are the ones who are during cesarean are giving it. Secondly, it has to be given slowly, should not be pushed in immediately. So care has to be taken about that. So far, I have not come across contraindication for using of this drug, and I think it's been used in majority of cases safely. But the paramedics, the anesthetists, all should be equipped about the knowledge of this carbetocin, how it is to be given, how slowly it is to be given, how diluted dilution should be done and should be given very slowly. So those important points should be known to each one who is going to assist you in your delivery.